Hey everybody, welcome to another Mancoll Minute. Hope your week's gone well. Again, lots of questions this week about breast implants, and one came up, I call it a breast implant safety question, and that is, how do implants affect mammograms? There was a question that said, I heard that they can block being able to check the breast. Well, that answer is true. I mean, if you put an implant in and you're doing a standard mammogram, there is a percentage of the breast that might be obscured or distorted with the presence of an implant. And if you're above the muscle or if you're below the muscle, that number can change. So what I tell folks is, if you have a high risk type of breast, family history, especially if they're young, gene positive, then one, you may need to have other conversations about how to manage your breast before you put implants in. But if you're kind of like 85% of women that ultimately do get breast cancer, there's no family history, we have kind of no way of knowing that you're that person. What I would tell you is, if you're really worried about it, we're going to go below the muscle, partially below the muscle, because with that, maybe 7 to 8% of the breast could be blocked or obscured by the implant. If you're really not at risk, or if you're really just not a worry for you, going above the muscle may have an 11 to 13% based on some of the studies I've read, so it's slightly higher. Now, keep in mind that we're not in the world of medicine where we only have one way to evaluate a breast. Every woman should be doing a monthly self-exam. We have mammograms, we have 3D mammograms, we have ultrasounds, we have MRIs. So ultimately, if there is a worry, concern, or risk, there is a technology that will allow us to fully evaluate your breast. With that said, even on a standard mammogram, if you have implants now and you go to get a mammogram, one, you should tell them, and typically they'll do a couple of extra views that help push the implant out of the way in one direction or another to further show the breast, so as to minimize that zone that may be hard to see. So although there is some obstruction, in my mind, if you're a low-risk patient for breast cancer, there's no reason not to have an implant. I hope it answers your questions. Have a great weekend.